I'm J.W. Fisher. I'm president of Fisher Contracting, and I'm chair of the Great Lakes Bay Region Mental Health Partnership. We made it a priority after I attended a 2018 Mental Health Summit that the Alliance hosted. And by 9 o'clock in the morning, it was like the scales fell off my eyes. I realized what a huge problem this was. I recognized problems in my employees that maybe previously I wasn't paying attention to. And I realized that we were pretty uniquely situated to make an impact, at least with our employees. The summit highlighted 3 problems that really resonated with me. The first was there's still stigma surrounding mental health. You wouldn't think maybe in 2020 that stigma would exist around mental health, but it does. Our employees were embarrassed to admit that they had problems, and they were actually kind of afraid that it would affect their employment if they admitted it. Then employees needed education just like I did. If I hadn't gone to the summit, we wouldn't be here today. So they need to know where to go to get help. They need to know about the problem. And so that education was a roadblock to people getting help. And then even though we had good insurance in 2018, it didn't pay a dime towards mental health assistance until the employee had burned through their deductible. And that cost was just a hard block for our people. They just weren't willing to bear that cost, so they wouldn't get help. So those are some of the things that I learned from the summit that I thought we could address. As a result of the summit, I chaired a work group to develop a mental health program that eliminated as much as possible those 3 roadblocks I just talked about. We created an owner's guide to creating and implementing a company mental health program, and that is intended to be a template that any company can use to build their own program. It describes the steps we took, and it describes the costs that were associated with it. And in addition, we provided some education for our people. We did that at a company-wide rollout of our program, and we made it part of our safety orientation. So new employees see it on the first day they come to work for us, and they see it a couple times a year after that at their safety toolbox meetings. And then we dealt with stigma by having 2 well-respected employees describe their mental health stories to our entire team at that safety kickoff. And their willingness to do that just went a long way towards eliminating stigma from our employees. And then we dealt with the cost by we just tackled the problem head on. We changed our insurance so that instead of an employee having to exhaust their deductible before mental health paid a dime towards professional help, we now treat it just like a doctor's visit. And day 1 of the plan year, they'll pay a small copay just like if they went in for a sore throat or some other medical problem. And that's probably maybe the most important step we took to getting them affordable quality care. The whole point of this was to create a template that any company can use to build their own program. We put the resources on the Alliance website for any company to use. They include the owner's guide to creating and implementing a mental health program that walks you through how to set up the program, and it includes all the costs that we had setting ours up. So companies can make business decisions around this. It includes the American Psychiatric Association Working Well Toolkit, which is a great reference that I use to help build our program. It's written so that a non-mental health professional can understand it and use it, and I found it very useful. And then we have an example workplace mental health kickoff presentation that I used when we rolled this out to our employees. So the materials are practical. They include the actual cost of what the Fisher company spent in an entire plan year. So I encourage any company that's interested to take advantage of it. Aside from the toolkit, we're working on several things. For instance, we're tackling the problem of stigma head on. Well, you know, our employees have really embraced the program. It's helped to educate our employees. It's created a culture where it's okay to ask for help, and has removed the financial obstacle to getting it. And the proof is in the numbers. In 2021 alone, our 325 employees and their families had 284 office visits. They had 13 substance abuse visits. They had 37 inpatient days, which kind of surprised me, and 23 visits to Children and Family Services, which is really just another provider, so it's really the same as a mental health office visit. So I don't think I could have expected a better result. It's been really well received. Our employees have really embraced it. For me, I think it differentiates us from our competitors. This is a pretty tight labor market, and anything you can do right now to keep and retain employees is important. They've taken the time to personally tell me how grateful they are for it. Well, if you'd like to learn more about mental health resources and hear stories from around the community, please visit the links below. I think you'll find them interesting and helpful, and thank you for your time.